Welcome to Beyond the Margins, the podcast, the place where we engage, educate, empower, and elevate. I'm your lead learner and host, Dr. Sohn A. Each week, I sit down with some of the brightest minds and dynamic leaders in education to challenge traditional narratives, especially those shaping the experiences of students at the margins. Together, we explore new ways to reimagine schools, classrooms, and learning communities as spaces for growth and transformation. At Beyond the Margins, we center students too often overlooked, sharing the stories, strategies, and ideas that matter most. Voices long pushed aside are brought to the center. Welcome to Beyond the Margins. You know that education is one of the strongest predictors of your health and life expectancy. People with higher levels of education are more likely to live longer, have lower rates of chronic disease, access better health care, experience greater economic stability, and it's not just about degrees. It's about what education unlocks: income, environment, access, and opportunity. So when a child walks into a classroom, we're not just shaping their academic future, we're shaping their health trajectory for life. Today's guest will help us see education in a way most people never do, as a public health intervention. Dr. Okey Enyia is a public health policy expert, strategist, and founder of Enyia Strategies, where he works across local, state, and federal levels to shape policy that improves lives. With over 15 years of experience, including working on Capitol Hill, his focus is on building what he calls infrastructure of influence that centers equity and outcomes for Black communities. He's the author of the John Henry Health Equity Playbook and founder of the John Henry Institute for Black Men's Health and Policy Innovation. Dr. Enyia's work challenges us to rethink a core idea. Welcome. Thank you for being here today with us, Dr. Enyia. It's a pleasure to have you on Beyond the Margins.
Thank you so much for having me.
Glad to have you. Hey, look, before we jump all the way in and start talking about the intersection of public health and education, you've been around a long time. You've been around more than 15 years in advocacy work in public health. Tell us a little bit about your professional journey. How'd you get here?
Yes, my steps have been ordered. I will lead that way and say that actually, growing up, I wanted to become a medical doctor. And in fact, that was the journey, that was the path up until about 2010. So as I, grew up and got through college, I took the medical college admissions test 4 times before finally getting into med school. And I applied to med school 4 times. And I was really glad to have gotten into medical school to become a physician. But I knew getting into med school that the vision for me was going to be bigger than seeing patients as a physician, actually. And so as I worked with patients and knowing that I had an interest in going into public health as well, I saw the disparities in the ways in which Black and brown patients were being treated. And that really sparked a fire in me to look at the broader context. Like, why is this happening? What can I do outside of the patient's, kind of patient care piece to effect change? And so it became a matter of, having this interest in equity and then also policy, because now at the stage of my career where I have a doctorate in health policy, it's if you're not at the table, you are on the menu. And
That's good.
And I take it further to say that if you're able to help to build a table, you get to decide what gets served. And so for me, it's been a matter of having mentors and advisors and just, navigating my very diverse career trajectory, working in the private sector, in the public sector, for not-for-profits, in Congress, at the state level. So I'm now at the place where I have my own policy advocacy consulting firm called Enyia Strategies, where I help people shape policy at the local, state, and federal levels. I now have my second book called the John Henry Health Equity Playbook, a 4-year health policy agenda for Black men. I have my not-for-profit, which is an outgrowth of my book. It's called the John Henry Institute for Black Men's Health and Policy Innovation. So for me, it's been, I started on one path and navigating the workforce and being in and out of school and living life and navigating these ecosystems as a conscious Black man has gotten me to the place where now I'm very clear on the ways in which I want to build infrastructures for influence. And so my body of work really is very intentional about centering the unique needs and assets of Black men and boys.
Yeah, that's perfect, Doc. And I love your verbiage. Would you say the infrastructure of influence?
Absolutely.
And listen, Black people, brown people, marginalized people have had this contention for a long time around access,
Mhm,
be it to education or to healthcare.
mhm.
And so let's talk about education as public health. Sometimes people don't necessarily see the connection between the two, but I know you can draw that connection for us. So how can we draw that line between public health and education?
Yes. So I use what I call what is called the social drivers of health framework. And what that is that those are the factors that shape 80% of health outcomes. And those factors are um, income, education, employment, housing, food insecurity, having access to a car, right? So
Mhm.
it's those factors that shape the extent to which you're able to access care, or said differently, it's where you are born, live, age, work, play, worship, right? So those ecosystems, those spaces that actually shape 80% of outcomes, whereas the remaining 20% is centered on the actual clinical encounter and genetics, right? So now we know, and it has been well established that the more someone is educated, the better they are outcomes are in terms of their health and well-being.
Right.
And so I always say that um, your your health is your wealth, and we know that again that those communities that are more educated, are more likely to have access to resources, which can make their quality of life better. In fact, there was a study that was done by a colleague of mine, Dr. Thomas Leviste. I think it was in 2023. He found that racial inequities in terms of education and health cost the U.S. Over $1 trillion, and that was in 2023, right?
Yeah.
So that article really dove deep into making the connections between levels of education and health outcomes.
Yeah.
And so, yeah, that's how I would kind of draw that line.
Yeah, like even when you look at things as as vast as life
Yep.
expectancy, there's a direct correlation between life expectancy and level of education obtainment.
Yes.
And because of educational obtainment, lots of these other public health challenges, not just health related, but housing,
Hmm.
nutritional stability, all of those things are indicative and can be determined by levels of education. Absolutely.
Yeah, and and to follow up on your point about life expectancy, I grew up on the South Side of Chicago. Place matters, zip code matters in terms of health
Hmm.
outcomes, right? There is a 20-year difference in life expectancy between the
Mm,
most affluent parts of Chicago and the most disadvantaged parts of Chicago, which are mainly Black and brown, where I grew up. 20-year
hmm.
life expectancy difference, right? Where I live in DC, in Southeast DC currently, there is a 27-year gap in life
Mm,
expectancy between the most affluent ward in DC, which is Ward 2, which is Georgetown, and Wards 7 and 8. And I live in Ward 8. So
hmm.
again, that speaks to the outcomes and the policy decisions that shape outcomes. Yeah,
Yeah. Yeah. I wonder about what information can be extrapolated by the snacks and
that
breakfasts
part.
that kids eat
Right.
on their way to school in the morning.
Yes.
Is it fries and pickled eggs, or is it an apple and some orange juice?
Right.
And what does that look like when it's kind of extrapolated out over a lifetime? We
Absolutely.
talk about food deserts,
Mhm.
and how is it that food deserts coincide perfectly with low schools and low performance in education?
Absolutely.
Yeah. So specifically, Doc, can we talk about how some of these public health disparities show up directly in the classroom?
Yes. So we know that this is a very complex, issue, but if a child is not eating well, is exposed to different types of traumas, if they're living in an impoverished, space or environment, if the quality of the schools or the teaching is not up to par, those various factors are shaping the extent to which those children are literally able to learn.
Hmm.
If children are trying to learn in a school that is hot, that literally is hot because it's in a heat desert, then that takes away from the ability for the students to learn effectively. When the school system is supported by the tax base, again, place matters, then the quality of the food that is served also shapes brain health and physical health,
Hmm.
right? And we know like this has been well established. Like these various factors are what shape outcomes. And so as well in impoverished communities where it is more likely to have lead in the water, right?
Hmm.
Or other environmental toxins that impact cognitive development and learning, that also shapes outcomes. Let's take Flint, Michigan, for example, water, right? Just having clean water is another example of a policy failure to address the root causes of what we saw in Flint, Michigan and across the country. So, yeah, I mean, and, we can even, kind of touch on mental health, right? So
For sure.
when there is a dearth or a lack of therapists or counselors who are culturally humble,
Hmm.
culturally competent, culturally sensitive in the classroom or in the schools, then again, that shapes the learning environment, right? So it's all connected in some way, shape, or form. And so for me, it's about how can I help people see themselves in the policymaking process wherever you are,
Yeah.
and it's informed by my background as a staffer on Capitol Hill, where I work both in the House and the Senate, as well as my work on the ground communities.
So let's talk about that a little bit in your policy advocacy work. Where's the gap occurring between, let's say, the decision makers and where the rubber meets the road around these big ticket public health policy issues that are, generational crisis for Black, Brown, and marginalized communities?
Yeah. So as a student of history and as you are a scholar of history as well, the public health infrastructure has historically been underfunded and disinvested in. And part of the reason why that is because most of public health isn't necessarily like seen. It's not necessarily obvious. It's not like a punchy type of, harsh
It's not
thing.
cool and sexy.
Right. It's
Yeah,
not, it's
yeah.
exactly right. Now, COVID-19, it brought to fore all of the historic entrenched disparities that had not been supported in ways that could prepare us to better navigate the COVID-19 pandemic, right? And so part of it it's an optics issue where public health isn't sexy. It's not necessarily, but if you think about the contributions that the public health field has created, seatbelt laws,
Mhm,
smoking laws, vaccines, I mean, you name it, it's all tied to public health.
mhm,
So for me as a systems thinker, as someone who is trained in public health and policy, I've been very intentional about bridging the gap between the pain that's happening on the ground and how that can translate into policy speak at the local, state and federal levels. And so I try to frame, because I'm trained such that I can look at any policy, but because of my training, I can frame it in a context of some area of public health.
mhm,
And so, again, it speaks to the social drivers of health that I mentioned earlier, where if you look at transportation policy, why is it taking patients 2 to 3 hours to get from their home to a clinic or a hospital, right? So, and can that patient afford that car to get to where they need to go? Are,
yeah,
are workers being given a living wage that is commensurate with what is able to support them sustainably?
right.
Where are people living, right? And in terms of redlining and all that, how that
Mhm.
shapes outcomes. So
Even things like outdoor space and parks and
yes,
public parks
yes,
and trees and population ratios, those things matter.
yes,
And when we talk about like urban dense areas where you have a student who's in an urban
hmm
environment who maybe had some aces that
right,
they come into the school with. They have some trauma
hmm
that they come in school with. They have some hot Cheetos
right,
that they come into school with. And then we talk about the brain science, right? And how if a young person's adolescent brain is in survival mode,
right,
is incapable of receiving instruction and
absolutely,
education and developing to the next level.
right,
So it seems to me, and obviously to you, brother, that if we're going to address how students come and show up to school, we can't do that just within the confines of education.
correct.
It has to be a public health approach.
Absolutely, absolutely, and that's been what I've been pushing for. And for me, I'm real big on civic engagement. So
Mhm.
meaning that it's not just about the literal act of voting. It is educating yourself and others, and being able to build relationships with key decision makers and educating them on the pain that you are experiencing. And so part of it too is how can we as leaders help our family, our loved ones, our communities to connect the dots between what's happening in their community and what is happening at the decision making table? How can I, for example, help people tell a story about themselves to key decision makers that can shift the narrative for the outcomes that we want to achieve? And we are we are battling a the social and governance structures that are afraid of our power, our voices. And I've been saying that, hey, don't let the social and governance structure talk you out of your voice, talk you out of your power.
Mm.
Thinking back over the course of history with the progress and the backlash, the social and governance structure wouldn't be doing all that they are doing to suppress the vote if they were not afraid of our power as people,
Mhm.
right?
Yeah.
So that's part of what I'm pushing. That is part of how I'm trying to help to shift the narrative, especially given the fact that this is, I would argue, the most consequential midterm election year in generations.
Yeah.
And so I'm just real big on framing this year for me as civic health is public health.
Yeah, and like, as we approach this, election cycle, and we're talking about so many things, banning books,
hmm
restrictions on, the federal education department, and you speak about this power and voice. And so I'm marrying these two things of power and voice to the community, as well as simultaneously we're having a shutdown of free thought and exchange of ideas.
hmm
And I'm wondering, when we talk about these structures of governance, what is it that educators need to do to ensure this so-called hidden curriculum does not continue to be a shadow over the progressive and revolutionary work that's been done and being done today and in the past?
Yeah, man, that's a powerful question. And in fact, just I just replied to a call for proposals for a book chapter that speaks to
Mm,
the hidden curriculum, the
mhm,
unspoken norms, what is hidden, what isn't obvious, and part of it is us doing the work to continue to tell our stories and sharing our knowledge in ways that can resonate with the audiences and people that we're trying to reach. And, and so, for example, with my book, so I'm on a book tour now.
mhm,
My approach to helping to address the hidden curriculum, because I've lived it in my doctoral training in the workforce where there's these unspoken norms, and like you're the only guy that or person that doesn't know this or doesn't or has to learn a hard way about how to navigate politics, and like all of those things, is at least for me, writing a book that shares all of my experiences and being very intentional uh, about disseminating that content in different ways over the course of time.
mhm.
Uh, along with that, though, because the power is in the policy, what, how can I help people see themselves in some way, shape, or form in the quote unquote policymaking process?
Yeah.
Policymaking isn't just about kind of going to the floor to make a statement. Like, yes, that's part of it, but there's a plethora of ways to help to influence policy. That can look like sending a post to a local council member about an issue. That can look like calling your member of Congress. That can look like sending an email. That can look like attending a virtual town hall. That can look like working in collaboration with other entities that have a similar mission, vision, and values. And so the hidden curriculum is always going to be there because that's how it is structured. But it is in literally having these types of conversations that will raise awareness about what is not being said, and then us being very intentional about sharing our knowledge. That is the African way. It is the oral history that we're able to pass down. But also, as importantly, it is what is written and what you share that will help to give you some context and a framework and approach for how to navigate what's hidden so that you're able to be more astute and have more agency when it comes to ways in which you are able to help shape, again, the policymaking process wherever you are.
Beyond the Margins, the podcast, will return in a moment.
Your Divine Journey, LLC, is here to walk with you through life's ups and downs. Whether you're seeking therapy, life coaching, support, or personal consultations, we provide a safe, empowering space to heal, grow, and step into your best self. Your journey is unique. Let's make it divine. Connect with us today and start moving forward with clarity, confidence, and peace. www.yourdivinejourneyllc.
At the Travel Bureau, we are dedicated to creating bespoke luxury experiences for the discerning traveler, specializing in detail-rich journeys designed with heart and intention. We turn your dream getaway into a beautiful, curated reality. Wherever you're going, the Travel Bureau will get you there in style, comfort, and joy.
If you're teaching urban, alternative, or non-traditional students and wondering why engagement feels harder than ever, the new book by Dr. Sohn A is for you. Unlocking Student Engagement isn't theory. It's real strategies for real classrooms, built on trust, relevance, and relationships. And educators across the country are already responding. Unlocking Student Engagement debuted at #1 in cultural pedagogies, philosophy and social aspects of education, educational professional development, and educational certification and development. Grab your copy today wherever you buy books, and let's change how engagement shows up in our classrooms.
Welcome back to Beyond the Margins.
As you brought up, that there are a lot of different entry points and participation in the policymaking process. And that is not just one way that you have to go about it or one thing that you can do. So to that point, what separates effective advocacy that actually leads to like changes in policy, support, funding, from what I'm gonna call a paper or advocacy that's in, action and word, but not necessarily in change and transformation? What separates the two?
Yeah. So one is a shift in mindset, meaning that, and I say this all the time, it's about playing chess and not checkers. Meaning, on one hand, yes, you want to secure the small wins, the small policy wins, or catch the lowest hanging fruit of your effort, of your work on an issue. At the same time, what is your long game? What is the long game strategy? What is the plan? What is our quote unquote Project 2025, right? Which is why I wrote my book and framed it the way I did it as a 4-year health policy agenda for Black men, because I wanted to be very clear and intentional about providing a framework, a path, a roadmap for this long game approach So possibly, because it's going to be crystal clear for anyone who wants to shape policy to get clear on what you bring to the table. What are you good at? How can you um, uh, leverage your experience and your expertise to help to move some policy issue forward? And so it is knowing that more often than not, it's a long game. It takes months, it takes years. And so, for example, with the Affordable Care Act, that took literally decades to get to the point where, yes, it was finally signed into law um, in March of 2010. But that took years of advocacy. So part of it is just getting kind of shifting your thinking around the fact that this is long term. At the same time, what can you do in the short term to help to raise awareness of some issues that can ultimately gain traction? And so, for example, we are in a very critical policy window right now as it relates to the establishment of a federal office of men's health. There was, in the early 2000s, federal office of women's health was established, which is great, but it has taken 26 years to get to the place where there is a policy window for the possibility of actually moving forward to put in place a federal office of men's health. And I say that because I've been tracking the activity around the country as it relates to men and boys at the federal, state, and local levels. And so, for example, several governors across the country in a bipartisan way as of last year were very explicit in calling for the need to support men and boys in some way, shape, or form. I'm working on on different ways to get that going across the levels of government. And I was recently cited in an article that again spoke to the establishment of a federal office of men's health. And so what that means is we are literally in a critical policy window where a lot of stakeholders, a lot of partners, a lot of organizations have been doing the work for months and years to get to this point where it's actually looking like we'll get some teeth behind us to get this signed into law, hopefully by next Congress, right? So that's just an example of the long game and the work that it takes in different ways to get to the place where this is a critical, open policy window where we all are seeing a lot of activity around this particular topic, and we're going to maximize it and lean forward.
Yeah. So I was born in the 70s. I grew up in the 80s. And one of my favorite candies was the Now and Later. You from the south side of Chicago. I'm sure you had your fair Now and Laters. And I feel like that's exactly the approach we need in our planning to move the community forward. Yes, these policy changes do take time. 20 years, sometimes 30 years. So that's the long game. We do need our own, Project 2025 vision for the future. But we also, I believe, need to have some actionable steps we can do right now.
Yeah.
Things that can be implemented in communities across the country, across the diaspora, really, not just in America. And so when you talk about things like your book, the John Henry Playbook, and these other resources, right? Yeah, show it to the people, right? So these other things, it seems to me that not only do we need these policy coalitions around health and public health, but we almost need them around every sector of the community,
Yes.
including education, and every transportation, communication, logistics, all of it, so that we can have go-to tried and true strategies and methods that can be deployed now and later.
Yes.
So tell us more about how you organize your book to be such a tool.
Absolutely. So I was very intentional in how I wanted to frame this book. And I was enamored by the John Henry metaphor for several reasons. One, in my research, I found that there were actually two real life John Henrys that helps to kind of create this or of a very strong Black man who raced a locomotive through a mountain. And while he beat the machine, it cost him his life. Right?
Yeah.
And so likewise, that mountain is a metaphor for structural racism, for chronic stress, for barriers, for issues that black
The
man,
struggle local.
yes, exactly, right? That black men have to navigate, but it's costing us our health and well-being, and it's costing us, thriving, right? And so that's number one. Now, I wanted to be very mindful of my audience because while I center black men and boys, I also want to be very clear in how I want to humanize the data that I collected. So I led with framing each section with a John Henry story to humanize that data. Said differently, I took a mixed methods approach to my writing, where I led with the qualitative or the narrative or the story, right? Because there was so much power in the story to humanize and contemporize the metaphor so that people could better see themselves in it. Right after that particular part of the section, for example, I followed it up with hard numbers like stats to say, this particular John Henry story, it talked about this black man who was having issues with his urination. We're trying to figure out what was going on. He didn't have insurance, and by the time he got to a doctor, they found out that he had prostate cancer. The quantitative data says that 1 in 6 black men will be diagnosed with prostate cancer this year. Black men are twice as likely to die from prostate cancer compared to white men. So I framed the issue in terms of a story. I follow it up with hard data, facts, evidence, and then I propose policy and practice recommendations to say, here are the ways in which we can address this issue. Here is language, here is data, here are very practical steps, step-by-step approach to how you can reach out to your member of Congress, to your state lawmaker, to other key decision makers to say, okay, my dad had this, I have had this story spoke to me, it resonated, I saw myself in it, and I also have the data to support this issue. And here is what I am sharing with you, member of Congress or state lawmaker, to say, can you include this information in that bill to help to allocate funding for programming, for training, for whatever else might be helpful, so that I know that I've done all that I can do to help to shape policy. And so that was my approach, was to lead with story, support with evidence, and to present solutions that anyone can take to support the work that they were trying to advocate for.
And I think that's a phenomenal approach. I think whatever we do in a way, it has to be solution oriented. So it has to culminate in some type of feasible, practical, realistic, obtainable solution that can be carried out. And so I respect and realize that there have been many strides into getting, particularly Black men, to be more open and vocal about their physical health and doing things like getting the prostate exam, which has, saved countless lives, but not enough Black lives. But I'm wondering, how much more work do we have to do on the mental health side?
Yes.
I mean, since COVID, there, like you mentioned, there's been a huge shift in how we see it and how we approach it. But what's still left to be done, especially for our community in terms of mental health?
Yeah. So the topic of mental health, especially in the Black community, it still has a lot of stigma attached to it, a lot of taboo. It's not necessarily discussed in ways that's that resonate with our communities. I have found, so I grew up Baptist, right? For me, I grew up, with this kind of framing of, Jesus will fix it. I mean, so
Yep.
yes, as a Christian, yes, I know that, but God also created people who are experts in fields that can help us to address, our mental health. The same way that you go to a surgeon to fix a broken bone, it's the same way.
And can I say something?
Yeah.
You know, Christian, and no knock against Christians or Muslims or
Right.
anybody else, but sometimes faith doesn't replace common sense.
Yeah.
If your car breaks down, no one just prays over
Right.
it. They send it to the mechanic,
Right.
right? No one just leaves it there and prays over it. So to that, we have to sometimes be more proactive.
Yes.
Please,
Yeah.
go ahead, Doc.
Yeah. And And so I'm real big, just kind of personally, on Jesus and therapy. Like, you can do both. That's my personal approach. I'm not trying to proselytize or whatever, but this is my faith that's talking. And so, and also, faith without works is dead. So there's a faith piece, but also, what is the action, right? What are you going to do next to get what you need, and which is also complicated by the broader structure or systems that make it more difficult for you to get access to care that you want. Now, from a training perspective and an access to care perspective, psychologists, and I see one personally, black psychologists make up only 4% of the field in the United States. 4%.
4%.
Black psychiatrists who are able to prescribe medications make up only 2% of the field. So that gives you these stark disparities in terms of culturally competent, culturally humble therapists that are accessible to those that want to be seen by a black therapist.
And truth of the matter is, a lot of black men are not going to go unless they can sit in front of somebody who they can relate to.
Exactly.
Let's be real. And yeah, black women are great for that, but sometimes we need that relation with a brother, right?
Absolutely.
And so I believe that every black man needs a therapist.
Yeah.
I don't know, you can't be a black man in America and not need a therapist, right? But it has to be more brothers like me and you who will say that out loud.
Right.
I would give you my therapist's name, but I don't want everybody calling or booking up my time slots, right? But it's very important, especially when we're trying to do progressive work, because not only is there work and there's rest, but there's also self-maintenance.
Absolutely.
That is important for, brothers like you and me to do this for the long game, right? We just talked about some of it is protracted long game.
Yeah.
So what is it that we can do right now to get, what is it we can do right now that would encourage brothers to not only check in on their physical state, but their mental, emotional state as well?
Yeah. So I'm real big on, because I on panels almost every week. I'm on podcasts, almost every week. I'm very intentional about talking about my own self-care and soul care regimen as a black man, because it is important for us to normalize talking about it as black men. Because what I found is that when I'm talking about my own self-care and soul-care regimen, that gives other brothers permission to also open up and put the armor down, put the mask down, and say, wow, okay, like he's like, for me, I've had to overcome depression, anxiety, trauma, postpartum depression, all types of issues, right? I'm just very transparent about it. And I share that so that brothers can relate or have some language and context to, yes, I've experienced that, but I've also been blessed to have supports at some point in place. These conversations, talk therapy with church, fraternities, sports events, etc., to be able to figure out how to name your emotions. Because I say all the time that if you can name your emotions, then you can tame your emotions. If you can label what you're feeling, that actually brings down the levels of cortisol or the stress hormone to help you to regulate your emotions. And so it's a combination of finding the language that describes or articulates what you're feeling. It's not just, I'm feeling some type of way. Well, let's dig deeper. You know what I'm saying? Let's
It's named.
Right. Let's be precise in what you're feeling. Is it anger? Is it frustration? Is it excitement? Is it fear? Is it sadness? Like, so that's a key part of it. And, and I say this as well, all the time, is my self-care regimen is this. And, it has evolved because of my own lived experiences, right? So it is prayer, meditation, mindfulness, journaling, breath work, yoga, gym, music, traveling, those things that bring you joy, those things that remind you of who and whose you are, those things that keep you grounded. If it's sleep, if it's spend time with family. So that's the self-care piece. The soul care piece is going to see my black man psychologist at least once a month, having an executive coach, church, right? So it's those soul care things as well that I talk about and I try to normalize so that it gives other brothers language and context and a framework to say, wow, okay, he's on his panel. He's done this, and this. Well, and he's had to come through this. Well, these are things that he's been doing that has helped him to not just survive but thrive.
Yeah. Doc, what would you say to brothers? Because I can hear brothers now.
Mm-hmm.
Yeah, I am, but I don't have time
Yep.
for that. I don't have money for that. I mean, what is the true cost of not taking care of yourself? What would you say to a brother who maybe doesn't feel like he has the time, the resources, or even knows himself enough to know what makes him happy and what his soul needs?
Right. It is, and this is difficult at times. It is thinking outside of yourself. It is thinking about your family, your loved ones, people in your life that that you have a relationship with. And so we know that men who are married or have partners are, are are more likely to seek help, are more likely to live longer because they have an accountability partner,
Mhm.
a family structure that helps to keep them supported. And I say all the time that you can't be your best self by yourself. It takes community. It takes all of us. And yes, I get all of the challenges with affordability, right? Like I understand that I happen to be able to afford to some degree seeing someone on a regular basis. But there is a plethora of free online resources that are out there, apps, websites, etc., that really cater to safe, non-judgmental spaces for Black men to just be. So it's Black men have the shortest life expectancy than almost any other racial and ethnic group in the United States. And that is rooted in several things. I lean towards the structural barriers, the racism, those things that shape outcomes. But there are resources if you have a desire to get better. Free things that I do that's all the time is the journaling, is the meditation, is the breath work, is talking with trusted friends. Like those things matter. Those things make a difference. And so, yeah.
It's so important that, men in general, brothers more specifically, not only learn who they are, but fall in love with who they
Yeah.
are and figure out how they can feed themselves. So often we require feeding from others,
Yeah.
but we got to learn how to feed ourselves.
Absolutely.
Tell me this, Doc, if you could design an ideal ecosystem where public health and education and the larger society were working in a cohesive union, what would that look like?
It will look like structures and systems that meet people where they are. Can we, because it's how do we disrupt, dismantle, and or transform systems that don't work for those who have been historically marginalized. And so let's say, for example, in a school system, in a school ecosystem, have there been resources or funding allocated to a community or a school district that is intentional about creating robust wrap around services that support the holistic student from in every area? And I don't know if that exists, although I will say that those communities that have the resources, they invest in all of those things. And so we know that is possible, but it's not being extended to the least of these. It's not being extended to the historically marginalized. If we can spend literally billions of dollars a day on a war that is being waged, that can easily be reprioritized to support early childhood education, healthy foods, housing, all of these things. If the social and governance structures that are in place actually valued the humanity of those that don't look like them in power.
And that is the biggest if of the modern world in the Western Hemisphere, right? That is the if of all ifs.
Uh-huh.
So as we chuckled about the struggle upward, which is very real, how do you stay grounded in this work that you're doing that is very much existential and very much exacerbated?
Yeah. I channel my emotions and my energy into my writing and my books and podcasts and panels and my family. I've just because I know how I grew up. I grew up on the south side of Chicago. I'm the oldest of 6 kids, right? And so kind of growing up in a very humble beginning, my thing has always been, how can I make the world or this place better than how I found it in some way, shape, or form? And it is being intentional about creating a support system that can help me grow and mature. And how can I lift as I climb? And so what part of what keeps me grounded prior to my wife and my son has been my faith and my ability to channel my emotions and my energy and focus into getting my own lived experience out in written form, and I'm sharing that out with the world. And so now what really keeps me grounded, even more so, is my wife and son. They bring a renewed sense of purpose and drive to why I'm doing what I'm doing, and so I now look at everything that I do, every decision that I make through the lens of legacy and inheritance. And so that is part of what keeps me grounded.
Hey man, legacy and inheritance. Those are 2 critical things that we all need to be considering as we try to move the work forward.
Absolutely.
So before I let you go, please let the Beyond the Margins family know what's coming down the pike for you and how they can stay in touch with you.
Yeah, so I'm really excited to be leading conversations around men's health. I've been asked to moderate a congressional briefing that is hosted by the Congressional Men's Health Caucus in June, and I'm really excited to bring to bear my work and the work of my colleagues from from around the country to really lean into this critical policy window. I'm also excited to be able to build out my not-for-profit, the John Henry Institute for Black Men's Health and Policy Innovation, which is again an outlay of my book, and it's a way for me to have more influence and a greater platform to effect change for Black men and boys. I have other things that I'm working on, but folks can find me on all socials. My website is Enyia Strategies. That's ENYIA strategies.com. You can find me on LinkedIn as my name, Okey Enyia. I'm on Facebook. I'm on IG as Enyia Strategies. I'm on TikTok as Enyia Strategies. So if you Google me, you'll find me. And that's where you can find my books as well.
Good. All right, last one for you. If there's one thing that you would tell a brother out there listening today, what is it that you want them to walk away with knowing? What's your message to the men?
Yeah, so I'm going to answer that question with my faith hat, and I'm going to, share one piece of scripture that I think will resonate in terms of vision for Black men, and that is Habakkuk chapter 2, verse 1-3. And it is, this verse of scripture has been so key in my own personal development and has helped to keep me grounded and sane as I have been navigating my own projects and getting and walking in the fullness of my assignment and my mandate. And that is, quote, write down the vision and make it plain so that they may run who read it. For the vision is yet an appointed time, but at the end, that vision will not lie. Though the vision tarries, wait for it, because it will surely come and not delay. So I want to encourage, all the brothers, all the Black men to keep your vision. Brothers are doing great things. Lean into your history. When you know your history, you know your power. Rooms are not complete until you enter them. So walk in that confidence, knowing that you are what that room is lacking. You carry what any room needs. And so I just want to encourage brothers to continue to strive to get clear on who and whose you are as men of African descent.
Hey, listen, Doc, thank you so much. This was a valuable conversation. I know it's going to help people. It's going to help brothers. Thank you for the work that you do and that you continue to do in the community in the interest of all of us. We appreciate you and your family to Beyond the Margins. We'll have you back maybe after the election cycle to talk about what we need to be focusing on.
Absolutely.
If education shapes 80% of health outcomes, then schools may be one of the most powerful health systems we have. If education determines income, and income determines environment, and environment determines health, that education isn't just preparation for life. It is life. It's prevention, it's protection, it's policy in action. I wonder, what would happen if we funded schools like hospitals or war machines?
Next time on Beyond the Margins.
I've been cussed out by a few parents, right? And so I'm saying this because they're never coming at me for any other reason than to protect their kid. And so sometimes once you can do that and unpack that conversation, you can figure out what the need is. And they don't want to tell you because they don't trust you, because they don't want DCF or whatever knocking at their door, right? They don't want services, police, whatever. Because it's not always great. Sometimes it is, but it's not. And so you have to bridge this conversation around trust. Like, I need you to hold on to your kid's education, right? And that conversation was hard enough as it is. And I want you to know I'm not here to harm you, but I am here to protect them. So it's like, how do we have that difficult conversation of, no, y'all got to do what y'all got to do at home, but over here, they got to get it together because my job is to get this kid a diploma. So how do we bridge that conversation? And it really was rooted in trust.
Thank you for joining us on Beyond the Margins. If you've enjoyed today's conversation, share this episode, rate and review the show, and let's keep the dialogue going. If you would like to connect, email me at Sohn@beyondthemarginsllc.com. That's SOHN@beyondthemarginsllc.com. It's been a pleasure being with you. Until next time, keep teaching, keep learning, keep leading, and keep pushing beyond the margins.